Normally, as a Francophone person, I speak in French. But today, I am in London, and I will speak in English. Honorable ladies and gentlemen, it is a tremendous honor and pleasure to be invited to talk at this very historic family planning summit, focusing global attention on one of the most serious and neglected public health issues. Thank you to the UK government and to the Bill and Melinda Gates Foundation, along with the UNFPA. We know that family planning is one of the most cost-effective interventions available to save life and improve health of mother and children. However, much needs to be done in order to turn this knowledge into action. As a mother, I know the joy of having a healthy child I plan to have. But as a doctor, I have seen firsthand how unintended pregnancies, frequent birth, and lack of birth spacing can have disastrous consequences. They threaten the survival of mothers and their newborn, and negatively affect the food security and education of the entire family. I have listened to the voice of men and women in my country, Senegal, and all over Africa, and I know that each one of them dreams of a better life and better future for their families. Today we share a common vision across the globe to allow every couple access to contraception so they can plan their family and allow their children to be healthier and more prosperous. By supporting strong and healthy families, we can build prosperous nations. Ladies and gentlemen, on behalf of the President of Senegal, His Excellency Mr. Macky Sall, I stand here today as a Minister of Health and as a global champion on women's health to commit to making family planning a top priority in our government and country by making information, supplies, and services available to all women in need, and especially the poor and the most vulnerable. National health insurance and maternal, neonatal, and child health are high priorities identified by the Senegalese government, and we recognize that family planning is an important investment and to achieve our maternal mortality and infant mortality goals. Also, we are very proud of our performance related to child mortality. If you have read The Lancet, you have seen how the country is doing, but we know that the journey remains long and hard for Senegal to reach the MDG 5 target. In fact, between 2005 and 2011, the maternal mortality rate has almost not moved, and our contraceptive prevalence rate is 12%. Is one of the lowest in the world. We will not accept the status quo anymore. That is why we are here today to share our commitment and vision for rapid and transformational change. We have set ourselves ambitious goals, and we are fighting to achieve them. Our vision is to more than double the national contraceptive rates, prevalence rate, moving the needle from 12 to 27% by 2015. We are committed to working in partnership with you all to put the needed solution in place to achieve this goal and to ensure that women have equal access to quality and affordable services for maternal and child health. Last year, we defined a strategic roadmap with strong guidelines, but we were lacking a clear plan for the way forward. This year, the government has done that in a transparent process, including religious, community, private sector donors, civil society, and multilateral organizations, to define an action plan based on our local challenges. Now we are armed with this plan. Our bold vision for Senegal encompasses 3 critical priorities: build demand, improve supply chain management, and offer quality and also increase access. First, we are working to make family planning socially acceptable, openly supported, and widely used. Delivering this information and breaking down existing misconceptions means investing in a high-quality mass communication campaign based on community mobilization and helpful information. We will include religious leaders and political leaders as spokespersons and discuss with couples, men, and young people. Second, we have dramatically improved our supply chain management because we faced the persistent problem of running out of supply. By redoubling our efforts, we managed to shake off our complacency and boldly tackle the root cause of both the national and local level. Nationally, we have successfully clarified and improved the efficiency of our forecasting and order processes. And locally, we have implemented pilot project for informed push model to reduce supply shortages to 0. Third, we also look at the private sector and to community-based approaches to expand family planning access and use. For example, mobile outreach clinics, social marketing, and franchise models have proven to be especially helpful in supporting the use of long-acting family planning methods. At the same time, we are scaling up community-based distribution to ensure that all parts of Senegal, even remote rural areas, are reliable and equal access to pills and potentially injectable contraceptive products. Dear participants, lastly, I want to highlight our keen interest in introducing exciting new contraceptive technologies that will help us meeting our goals for 2015 and beyond. Senegal is one of the first countries, along with Uganda, that will help test a new contraceptive product, the Depot Sub-Q in Inject. In parallel, we are working with community health workers to increasing women access to birth control pills and also injectable contraceptive later, such as Depo-Provera. All of these tremendous efforts are extremely promising, but we know that without the long-term engagement of government, they will be short-lived. So, we are hereby committing to invest the necessary resources to make this change happen and to reach our ambitious goal to 27% contraceptive prevalence by 2015. Because we are accountable to our women, our family, on this historic day in front of all of you, I am happy to announce that the Senegalese government will increase not only the budget line for contraceptive procurement by at least 200%, but will also double the budget for management of family planning program and action plan. The dedication of the Senegalese government to family planning is not only visible in our financial support, but also in our political actions, such as the elevation of reproductive health division to a direction. We are also working on improving the legal and regulatory environment and make it more friendly to family planning. To achieve our vision and close the gaps, we hope for the support of all stakeholders at this meeting. It is crucial for us that we work together, hand in hand, to meet our country's and our families' needs. I thank you very much for your attention and for all your help in building healthier families and a stronger Senegal. Thank you.